Aloha, everybody. Aloha, everybody. Again, this is Dr. Albert Lin. It's been a little while. This is the May 26th COVID-19 podcast. I haven't done this for a while now. As most of you guys have known, I took a little break for Memorial Day. I hope all of you guys had a good Memorial Day weekend as well. I think we all kind of needed a break from this kind of constant news, yeah? So a lot of stuff obviously has happened even in just 1 week. What I want to focus on today are a couple of things. I know I got really technical in my last couple podcasts, but a lot of new news has happened. Stacy, welcome to Stacy and Dan. Stacy, don't worry, I was a little late too. Welcome to Wall Street Surfer coming in, and welcome to Sam coming in. I'm also on Instagram Live, so hopefully I'm going to try to keep this to less than half an hour to an hour and just give a general update. So I'm going to focus on a couple things. Number one, some of the new news with hydroxychloroquine and remdesivir. Some of it's little old news, new news, and some of it you may have read a little bit. Number two, I want to give a good update on vaccines because a lot of news came out on vaccines recently. Again, mostly good, but I think there's some stuff about that. And number I guess 3 or 4 or whatever, I kind of want to put a little bit more work and discussion into what's going on internationally, because things are rapidly changing internationally. You may have read a lot of news about Sweden, about Japan, about parts of Asia, and obviously Brazil, and most importantly, Hawaii, where I am, because a lot of stuff has changed in Hawaii. So let's get going, and welcome to Amanda coming in, who I just saw out and about when I finally gone out, and welcome to DJ Hypno coming in from Instagram Live. So a lot of you out there. So number one thing I want to go on is hydroxychloroquine. Now this is, I know I've been talking about this forever, but everyone's been, having new information and news about it and theories. And the last time I kind of did the podcast, there was this whole thing that, oh my God, it's big news. Trump was taking hydroxychloroquine, and he's been taking it for a while. And it's not that he was sick. Again, he was using it what's called prophylactically or preventatively. And this was always the big deal with hydroxychloroquine, whether we should be stocking up on it and giving it to people kind of like you take a vitamin and preventing things and preventing getting COVID-19. And it's been really, really sort of bad news lately because a couple of the big studies showed the ones, I think there was one in Lancet, there was one in, I forget what other magazine, I think Science or something, but like big magazines, reputable journals that showed that if you give hydroxychloroquine to sick patients, again, hospitalized patients, not prophylactically, but treatment-wise, it was associated with much worse outcomes. They had more QT prolongation or heart problems and rhythm problems. So hydroxychloroquine wasn't a good drug, and that was negative news for everyone trying to use it. More importantly, the real big news was the study, the World Health Organization, the Solidarity trial. Now, a lot of you who've been checking out the podcast remember me talking about the Solidarity trial from a long time ago. They were studying four drugs. They're studying hydroxychloroquine, they're studying remdesivir, they're studying ritonavir, lopinavir, and they were studying ritonavir, lopinavir with interferon. The big news was the World Health Organization had to announce, and I think some of you read this, that hydroxychloroquine, they had to stop the arm. They had to stop it. They had to basically say there is enough data there. And welcome to Andy, Conigliaro, Marissa coming in now. So Marissa, I'm talking about hydroxychloroquine and bad news about it. So essentially the World Health Organization, which I consider, again, I know a lot of people don't trust the World Health Organization or the CDC in certain levels, but if you look at just the merits of the study, the Solidarity trial that was testing it against remdesivir and ritonavir, lopinavir, with and without interferon, the hydroxychloroquine arm had to be stopped because they had too much negative data, too much evidence that it was not a good drug. And not a good drug meaning that there were too many side effects, there was enough data to show that it was doing very poorly even against I think, placebo. Now, again, keep in mind, I checked on the recruitment criteria for these people in the Solidarity trial, and the problem is that this was still hospitalized patients. The World Health Organization did not test hydroxychloroquine preventatively, okay? They haven't done it preventatively. Now, there are studies being used for people who are asymptomatic, not infected with COVID-19, and seeing if hydroxychloroquine will still work for those people. So there is still a possibility that they may find that it doesn't have special or problems with side effects down the line for non-infected people, and it could be used safely prophylactically. But right now, the data doesn't look very good, definitely for even hospitalized patients, serious patients or hospitalized patients. So Wall Street Surfer, he mentioned here in Metro Detroit, they are inoculating healthy first responders with the drugs you're talking about to see what happens. So again, yeah, Wall Street Surfer brings out a very good point that even with all the data, I know doctors myself in New York and other places that are still using it. And John from New York mentions hydroxychloroquine with zinc may be still being used for non-critically ill, and there may still be a role for it. So I'm not ready to throw the book at hydroxychloroquine or even remdesivir, which I'll talk about in a second, because they are still being used off-label. There is, in my mind, a sort of thing where, you know, these are still the early day studies. There may be studies later that still come out and are still being done that negate these World Health Organization studies. Although, again, the World Health Organization Solidarity trial had a lot of recruitment, a lot of people. And most importantly, there may be a role still prophylactically or for non-infected patients or for mild patients, non-hospitalized patients. But I cannot say that you can guarantee that. So what I'm saying is that even with what Trump was doing, and he actually came out and said he stopped taking it. So everything that you heard about is old news, where he said that he was taking it and now he's no longer taking it anymore, okay? So, and the reason he was taking it was to sort of, because he was sort of getting tested all the time and wanted to prevent stuff, okay? And welcome to How coming in on Instagram Live. So going on with that, and you know, besides the hydroxychloroquine and zinc even, and they've been testing minor things like vitamin D, and there's some evidence for vitamin D. I mean, there's evidence for everything. They're still testing and researching BCG vaccine, the one that that they give to people to prevent tuberculosis in developing nations. You may have seen, again, a lot of your foreign friends have that little like sort of ring mark scar in their deltoid, and they're still testing that. Again, they were testing that in UK, they were testing that in Netherlands, and they were testing that in Australia, and I think they were testing it in Germany. I think that's the other place they were testing it. So those data will still come out. I even heard that there's some studies that are looking at the effect of just influenza vaccine prior results and MMR, measles, mumps, rubella vaccine for rates of people who had that and preventing COVID-19. But again, this is all early days data, Welcome to LaShawn coming in, and welcome to John and Allison and Carolyn coming in. Carolyn asked, hi, how is my hair still so stylish? Are salons in Hawaii open? Salons have been closed in California for over 2 months. Everyone looks like a caveman now. So Carolyn, actually, I don't know. I just sort of put a little water in it. I'm actually starting to think I may need to buzz it again. So I'm very close to giving myself my new second haircut coming down, you know, coming in soon. So we'll see. That'll go a little better. I've realized that the important thing about cutting your own hair and buzzing it is you have to scissor it to clean it up after you blend 4, 3, 2, and whatever. And that's how you do it. So going to John's point, John asked me if I saw the new CDC numbers, and I did, John. I will go into that in a second and why I think it's a lot more complicated than the numbers look, really. But first, before I go into the numbers internationally and the new CDC numbers and talking about Japan and Sweden and Hawaii and the reopening, I want to talk a little bit last about remdesivir again. Because if you remember what I talked about earlier with remdesivir, remdesivir, the initial numbers had come out, and they sort of falsely or inappropriately, I would say, early gave out information about the remdesivir numbers, saying that, for example, remdesivir was really good, and that's when the stock market, if you remember, started to take off again a lot recently. And the final data, the actual published article came out, I think in Lancet Journal. I sort of skimmed it about remdesivir. And again, I want to bring out the point, remdesivir is not a kill-all drug, okay? It is not, it's a treatment drug. It's kind of like Tamiflu. It's like the IV version of Tamiflu. You can only get it in the hospital, and all it really showed is for sick patients, I think needing oxygen, who were hospitalized, that the remdesivir reduced their hospital stay by like 4 hospital days. So it had no real effect on mortality. People who got remdesivir didn't live at a higher rate than the people who didn't get remdesivir. They just stayed in the hospital like 11 days instead of 14 days. So it's like Tamiflu. If you use it at a certain point, maybe your disease is less, but you don't have a better chance of surviving. So that's why I still am not a big like remdesivir, and that's the only FDA approved, will you say, drug for COVID-19 right now. I don't think it's a game changer, because again, what are we trying to do? We're trying to avoid people getting in the hospital. We're trying to avoid them being sick. So answering V's question real quick. World Health Organization say we don't have to clean our grocery store religiously anymore. What do you think? And welcome to Nicole Green coming in on Instagram. Wow, a lot of people joining today. V, you know, what I would say is this. I don't think you need to religiously clean groceries as much anymore. And I know part of their reasoning why the World Health Organization says we don't need to do it anymore is because they're saying that they think there's less contact spread, or what they call fomites, where they have stuff on your table and on the doorknobs and on, you know, refrigerator handles and on plastics and stuff. They're saying that they think there's less spread from that, and that if you generally clean your hands or just wear your mask, most of the spread is more airborne, and that's how you worry about it. So you still should wear masks. I mean, V, what I'm saying is that I think the World Health Organization, CDC, have clearly shown that they are playing catch up and they're behind the times. So do I think that you need to wipe down and hand sanitize every little single piece of fruit and every little single piece of, like, you know, meat and cereal and whatever? I mean, I think it's up to you. I think generally, especially if you're going to be cooking something at high heat, and baking it and like stir frying and sauteing it, then you don't need to worry. I would still probably wash my produce at least. I would still, and you guys may have seen that viral TikTok video and the things where the strawberries put in water and salt had like worms and caterpillars, and it's kind of nasty. So generally, like, I don't think you need to clean everything, but I would still wipe down shopping carts and doorknobs and, you know, those things. I think it's good still to clean, and 100% I still think a mask is worthwhile. And I won't go into the data, you've seen it all, about why wearing even a fabric mask should still be okay. And you know, I still think, again, if it doesn't impact your life a lot of people are saying, oh, well, what if I have, you know, medical problems or lung disease or something else, or shouldn't I get an exemption from this? Shouldn't I have some ability to be able to opt out? I mean, yeah, but I really don't think a lot of people have that sort of problem that they really should prevent from having a mask or something. So going into, I want to go back to John's question about, did I see the new CDC numbers? And John, I saw a lot of your posts about Japan and different things. A couple things I want to say about that. First of all, Japan, as a country, you see, this is what I don't like about cherry-picking countries. Like 2 or 3 weeks ago or a month ago, everyone was screaming about Sweden. Have you noticed that no one is talking about Sweden now? The people that were anti-vaccine or that were anti-wearing masks or anti-social distancing, no one's talking about Sweden. And the reason why is, as I've mentioned, the welcome Victoria coming in on Instagram Live, Sweden, their numbers are not good. They have the highest deaths per capita in Scandinavia, and they checked herd immunity, and their herd immunity is not even good. I'll give you an example. The herd immunity in I think in New York City is something like 20% or even more. I think it's up to 32% in the highest hit areas in the Bronx. And we socially distance. We tried to do that in New York. You know what the the antibody rate is in Sweden, where again, most of them are in Stockholm, they tried to, or not tried, but they didn't prevent herd immunity from happening, and they're only at 7.5%. And it gets even lower from there from some cities and states. Here's a question. Think about this as I talk about John's numbers and the CDC number. How much percentage of people do you think in Hawaii have the antibody? There have been studies done. So think about it, Google it if you want, but I'll tell you later. And that's why it's a very interesting thing, and you can't compare apples to oranges. You can't compare this and stuff. And even Japan did well. Yeah, the big viral article you're seeing, Japan did this all about a lockdown. Now, I know a lot of people are going to be saying, hey, well, look at Japan. They have major cities. Tokyo's really big, higher density, whatever. But Japan, here's the thing. You cannot culturally compare Japan to America. Number one, if I were to ask you right now, before COVID-19 started, which country do you most associate with being clean, or more importantly, wearing masks? If I ask you out of 196 countries, which country wears the mask the most? I'm guaranteeing you 9 out of 10 people would say Japan. So Japan already was a mask-wearing society very heavily. Their mask compliance usage was way high. I'd have to look at the numbers, but everyone who's ever been to Hawaii or been on a flight with Japanese people know that. Number two, they're very good at queuing and following directions, which obviously most of America and a lot of westernized countries do not follow directions. Japan is a very order-driven society, so even if you have the density that's there, they're all wearing masks. Every single one of them are wearing masks. Number three, Japan is by definition an insular island nation. They are an island nation like New Zealand, like Australia, and like Hawaii. And if they really didn't care about it, then why did Japan ban 110 countries from coming in? It's not that they think that they don't need to lock down. They do need to lock down from other places that they don't think are doing very well. And so that's my argument against Japan, okay? So Japan, the other problem is they have a word, by the way. Japanese are very insular. They're very introverted. They have a word, hikimori, Hikiwomori, or hikiwamori, hiwikimori, something like that. And it basically means a shut-in. They're so fanatical about that they shut in and they already socially isolate. That's the Japanese culture we're looking at, okay? So I will go into those numbers more again a little bit later when I talk about stuff, John, with the CDC, because I know the CDC revised numbers and said generally the case mortality rate is only like 0.04%. I will get into that. Here's a hint. What's the population of the US right now? And multiply it, and we'll talk a little bit later. So let me ask a little other questions, and wow, a lot of people joining. Lara, welcome to Sunny. So thoughts and guidelines returning to school. That's what Marissa asked. Marissa, that's a little outside my pay grade. I would say that I think all the countries that are opening up schools really well, like Australia and Denmark, they are still social distancing. They're having some kids only come on like every other day or something. Like if your name is like last name is A through M, then you come on like Mondays, and then N through Z, they come on Tuesdays, and you alternate. I mean, I think there's still a role for social distancing about that. And John said something about 6%. I'm not sure what number he's referring to over there. Lara also says, it's crazy. I have 3 young kids who have not gone anywhere. I clean and disinfect everything, but they've gotten common colds 3 times already since the lockdown. So I think they got sick from stuff, and then I got sick. So just my experience, but I tend to disinfect everything even more. And Hal said, Albert, what do you think about California? State is opening up and new cases are still pretty high. So again, you guys all bring up very, very good points. Lara has been cleaning excessively, and you know that kids, they can't socially distance. When you bring them outside, I even saw it on the beach when I was in Hawaii. I think everyone doesn't social distance well. When they were in the beach, we had this cute little Japanese girl, and she ran up and played with another kid, and her mom had to apologize to the other mom. She's like, I can't help it. She's friendly. She just wants to play with people. Kids get dirty. Little babies get dirty. They eat dirt. My nephew is essentially eating everything and puts everything in his mouth. So not to say they'll get very sick, but they will be carriers. And you, by virtue of being their parent or someone, could be a carrier too. And Marissa brings up another very good point. Welcome to David, working on the front lines over there. as an anesthesiologist, and welcome to Miles as well. Marissa brings up a good point. Internationally, this is why I think everyone's getting way too optimistic, and the stock market's getting ahead of itself. That's a whole completely different issue. And look at every other single country. As Marissa mentioned, in France, they had 80 schools that had to close down again. And they had to lock stuff down again because they had clusters appear again. So 80 schools got closed. With every single country, welcome to Heather and Jennifer coming in, with every single country that has reopened first, whether it's China, Singapore, France, South Korea had a bunch of new cases and clusters in gay clubs there. Any other country I can think of, there's been very few that have reopened first that haven't had new clusters and had to at least consider shutting down, especially the ones with bigger cities. And as you know, we are not a rural agrarian country in the US. We are not, if I focus on America, there are parts of America in the Midwest that may do better, and even Hawaii that has a major city and will do better, but we're generally a small country. An urban country. We're not a small country like some of these ones like Denmark and other things. And again, so that brings me to my next point, and that goes into John's point about, did I see the new CDC numbers? And the new CDC numbers are gone down, and they said that the best estimate is that 0.04% of people will have a mortality and a death related to a COVID-19 infection of all the people who get infected by COVID-19. Now that sounds like very little amount, right? 0.04%. Think about the math on that. I've done this already. How many people live in America? 370 million people, okay? Something like that. So multiply 0.04 by 370 million. What do you get? If in the most liberal, or I guess you would say most open society, if we didn't shut down at all, and we continue to not shut down, let's just say no more masks. Let's just say everyone has their way. We just say, you know what, we are too aggressive, forget this. Let's just, we can wait till the vaccine. Let's just get everyone sick and not worry about that. Then 370 million times 0.04%, that's something like 1.75 million still. 1,750,000 people would die still in the US if you completely open. Now, does that sound like a very low number to you guys? It doesn't to me. It doesn't at all. Even if you said this is like the most extreme flu, even in the most extreme flu season, you do not have 1,750,000 people dying. And keep in mind, that's with the flu where you routinely have some level of the population vaccinating. What don't we have yet? We don't have a vaccine. Welcome to Amy, welcome to Daniel coming in. So Daniel and Amy, I was talking about vaccines and new numbers and the World Health Organization saying that, the numbers are a little bit less. So yeah, John, again, 1.48 million people, 1,480,000 people. That is not any, and that's with social mitigation. That's with the social mitigation that we're doing now. These numbers are not forward-looking, John. They're retrospective. This is what you call in the market not a forward, like looking at the forward PE ratio or the forward-looking data. This is data looking at what's happened before, okay? So again, yeah, but of symptomatic, of whatever, the point is these numbers are very, very high and they do not involve any consideration of a vaccine. So welcome to Arthur coming in too. So again, the problem with the vaccine data that I've seen, and the big news is that Merck is a new company that is getting into vaccination, okay? So vaccination and the vaccination gain is way behind the ball. So how, I'm gonna mention, yeah, the best data that we've seen with the vaccine is that the vaccines and the timeline are still not gonna be before the end of the year. And I guarantee you with all the conspiracy theorists out there right now and the anti-vaxxers, they don't want, you're not going to get 90% or even 100, you're not going to get 100% of people vaccinated. You're not even going to get 90% of people vaccinated. In the beginning, when they say the vaccine's going to be ready for release, you know who's going to get it first? I'm going to get it first, and frontline workers, and unfortunately some of the, and the people who are most at risk, the nursing home patients, that sort of thing. They're going to get access to it first, and it makes sense. They're most at risk of getting it and most at risk of dying from it, okay? And that's important. So it's going to take a while. So let's say, just for argument's sake, we get it on January 1st, 2021. That's the beginning rollout. You have to scale up. You've heard this from vaccine companies. Scaling up is not that easy. Look at the end part of contagion, where they literally had to have like a lottery system and decide who gets it over time. So my best bet is for the majority of, let's say, US society, who we're gonna get access to the vaccine first, potentially, then it may not be until the summer or maybe even the fall of 2020, I would think, in order for it to roll out and have enough available to test or to vaccinate, let's say, a majority of the 370 million Americans. Let's just say also conservatively, again, this is just theoretical, but I don't think half the people in America want to take a vaccine. And there's an argument for that. Again, because right now it's emergency authorization for all these companies. Think about what happened when we let Abbott Labs and everyone else do testing for COVID-19. What happened? A lot of those tests were faulty or didn't work very well. So maybe a lot of the vaccines also won't necessarily work well in the beginning, or maybe they'll have a failure rate. I don't think the side effects will be that bad, because again, the side effects, if you think about it, they have to, that's what phase 1 is. Phase 2 is, phase 3 trials. They have to make sure that these vaccines, and that's why it takes so long. You got to study people who get the vaccines for a while and realize that the vaccines, will they work, A, to prevent disease, and also importantly, the number 2, or probably even number 1, most important thing, they don't give you something. They don't give you a bad side effect, that they don't create some super flu or get you suddenly really sick or get like Kawasaki disease in kids or anything else. So my point is, even if we got the vaccine tomorrow, I doubt that 50% of America, A, would want to take the vaccine, or B, have access to the vaccine for a long time. So my best case scenario, I'm not as optimistic as everyone. And I think the stock market's getting ahead of itself. I think that everyone who is thinking that we're all done is getting ahead of themselves, because even if we get it January 1st, 2021, we will not have good penetration of the vaccine or herd immunity have developed where you've vaccinated 50%. And again, if you look at your typical epidemiologists, they say herd immunity only really works if either you have the antibodies by developing the disease, or you vaccinate and get the antibodies against the disease with 60% of the population. 60%. So what is 60% of 370 million? That's, I don't know, that's more than 100, that's probably about 190 million, I think. About 190 million people in the US need to get vaccinated or have the antibodies. And we already said how many are infected, right? How many are actually infected right now in the US? I'm looking at coronavirus cases, there are only 1.7 million are infected. And we need 100, in other words, getting antibodies. And 100,000 of those have died. Only 500,000 recovered. So say there's not even a single death after this. There's, let's say, 1.6 million people in the US who've gotten it, recover from it. 190 million for herd immunity compared to 1.6 million, my God, that's an order of 100%. You need 100 times more people exposed and developing antibodies or vaccinated. That is tremendous. You need to vaccinate or let people develop the antibodies by 100 times the number of people that have been infected so far. That's a lot, guys. I don't know what you guys think. So I really am not too hopeful about the vaccine being available just immediately. Welcome to Diana coming in, and Beba, gosh, all the way from Montenegro, I think, or maybe England, and even Rachel coming in, also from Europe. So one other thing I want to discuss, because I've discussed, again, for everyone joining in recently, earlier in this, I talked about the bad data against hydroxychloroquine for hospitalized patients. And I talked about remdesivir and how it's good news, but I don't think it's a deal changer. Essentially, I look at remdesivir like Tamiflu for sick COVID-19 patients. It's not going to be useful for your average citizen, okay? And then a little bit about vaccine updates and why I don't think we are going to be socially distancing anytime, or stopping social distancing or mask wearing anytime soon. I'm going to talk about Hawaii reopening and travel updates and international updates soon. So another question, Miles asked, Have they determined if antibodies are permanently protective? Again, Miles, I think part of the problem for this is that antibodies, it's too early to say if antibodies are protective. We only recently got good antibody tests in the last month or so from Abbott, maybe the last 2 months from Abbott tests. So they can't test to see if people have protective antibodies until they study, right, the people who have antibodies and then look forward progressively, prospectively look 1 month from now, 2 months from now, 3 months from now. How long do these antibodies last? As I've said, I think if you look at every other disease before that's infectious, right? Like, for example, HIV, you can develop some antibodies to, but you're not going to be cured from it, let's say, and there's the problem is it a disease more like HIV, or is it a disease like the measles where you get a vaccine or you get antibodies to it and it's protective? My feeling is that it's probably going to be something in between, right? It's not that you're going to have zero immunity or you're going to have lifelong immunity, right? If you had zero immunity from it, then we would quickly be seeing people who have COVID-19 already and have antibodies, we quickly see them getting sick again. I also don't think it's just permanent immunity because, again, even like with booster vaccines for hepatitis, let's say, or MMR, you need boosters of these vaccines for them to effectively work. So I also don't think it's going to be lifelong in some way, okay? Tetanus, you need a booster, okay, for it every now and then. So I think it's somewhere in between. If it was my best guess, and I'm not a virologist, epidemiologist, my best guess would be is that we have a couple of months of immunity if you already get it, maybe not a year or something. But again, even if you have any little bit of protective immunity, that at least helps you from getting it again. And maybe this time you will be careful and wash hands and not wear masks. And I got to tell you, that's a little bit of my pet peeve right now, that everyone says, oh, we reopened, we don't need to wear a mask anymore or anything like that. John, that's a very interesting article. So John just posted up an article from South Africa about, and I read about this, a newborn baby died of COVID-19 in South Africa. And so his question was, is there any evidence of vertical transmission? For those of you who don't know what that means, vertical transmission is like if a mother was born with HIV, she would easily spread it to her baby. And that was really, really scary for a lot of people. And for a long time, we had a lot of HIV babies. John, what I'll say about that article is that if I read into it, and they didn't release a lot of data from that baby, but my understanding is, number one, that baby was very, very sick already. Very, very sick. So that's probably part of the reason why that newborn baby died. It was just a comorbid newborn, which I'll go into comorbidities because I do want to talk about that. And dying from it was probably because it had a lot of other diseases. So dying was very, I don't know, to answer your question, John, I don't know if that newborn baby got it from the mother or just got it because it was in a dirty hospital in Africa, in South Africa, unfortunately just got it. I haven't heard of any evidence about vertical transmission, but it would be really scary because, again, pregnant women who got COVID-19, you'd worry about what can you give them to prevent transmission to the baby. Is it remdesivir? Could you give them remdesivir? Is it safe for babies? I'm not sure about the data on that. Or could you give them something like, for example, HIV patients? Eventually, they discovered that AZT, the drug AZT, you could give AZT to HIV patients, and if you gave it to them early enough and consistently enough, HIV-positive pregnant women would not pass it along to the baby. In other words, a baby would be born safe without HIV. So it's really early, John. I don't know if there's vertical transmission. That would be worrisome to me, although I would say probably the percentage of patients that are pregnant with COVID-19 is sort of smaller generally. But there have been these weird stories of like pregnant women doing really badly. And there was a baby that was delivered. An American woman had a baby delivered while she was intubated and like suffering. And luckily, baby and mom are both fine, but that's really, really scary stuff. That also brings up another point about pandemic versus endemic. A lot of people are concerned that this will become endemic in society. My friend, I have a friend of mine who's a little bit more conservative. He says that we should just open this up. We can't prevent society from having COVID-19 and having and this become endemic. Let's just let it become endemic. Here's a problem with letting it become endemic. You are not counting those babies, right? those babies aren't born yet. So even if everyone gets infected and already has those antibodies, right? And they either die or they get the vaccine or whatever, this is still gonna be maybe more similar to something like the measles, right? The babies are still gonna be born, and those babies have never been exposed to it. Now, again, the younger population doesn't seem to do that bad, but are most parents and most pregnant women and most, to be expecting parents, are they gonna be happy in a world without a vaccine, or in a world where no one else is vaccinated, or in a world where their baby has to be exposed to all this? Because those babies haven't been born yet. No one has talked about this. I'm shocked that nobody has talked about the fact, and thank you, John, for bringing that up, that newborns are part of this equation. So what do we do about the newborn babies that are coming up? Because even if everyone's been exposed, even if we have 60% immunity or vaccination or herd immunity for whatever, and even higher, up to 90%, this will become endemic in society, but that's not something we should strive for. We should strive for a way to protect these babies somehow, okay? And Marissa brought up a very good point. So Marissa brought up a point that this article, and I don't think it was the exact article I read, but I did read articles similar to this where she mentions 19 times more likely to get COVID indoors than outside. So here's my advice to you in opening up. Because for example, Hawaii is opening up everything by June 5th. And I'm actually okay with that. I know I come across as, oh, shut everything down, social distance, wear a mask, don't do anything. I'm actually very pro Hawaii opening up, because we have 0 cases, 1 case, 0 case, 3 case, 0 case, 0 case, 2 cases, 1 case, 0 case. We have effectively stopped community transmission in Hawaii. So I'm okay opening up a lot of stuff. Welcome to Christine coming in, and Agnieszka coming in all the way from Singapore. So what I am saying is that, what they have seen is that as they open up restaurants, a lot of restaurants are looking, hey, how can I do patio seating, right? Open up things, let people open and eat outside. Personally, if I'm going to eat in a restaurant, I would rather pick a patio restaurant somewhere outdoors and indoors. Because as Marissa mentioned, the initial data is showing that it's 19 times more likely to get COVID indoors. And they looked at one of the, I think it's a restaurant in China, or it might have been Seattle, Washington, or somewhere where there's air conditioning. And they showed with 3 tables, with 1 person sick and 3 close tables, with the air conditioning circulating, so many people got sick. So if I were you, am I gonna go out to eat? I would still focus on takeout, but beyond that, if you have to eat at a restaurant, you wanna hang out with your friends, I would rather eat at a restaurant like Duke's, where I can have drinks and food outdoors in a patio, than go for an indoors restaurant. And I know that's not fair. That's not fair for small mom and pop restaurants. That's not fair for those small enclosed restaurants that don't have a patio and can't social distance. Then I think those restaurants should focus on a takeout business model. And it's going to be really tough, because I think even with that, they're seeing that they've surveyed a lot of Americans, and they asked them, would you be safe going out to eat? Would you be safe going out to shop? And a lot are not going to, and they're still not doing it. The malls opened up here in Hawaii, and they're not very well attended. People aren't really buying things. So welcome to Agnieszka again. So that's going into, so I'm gonna segue into Hawaii. I've talked about it a little bit. Hawaii still has a 14-day quarantine, and they're extending that all the way until end of June. And our salons are not open yet. They're not allowing the salons to open. So I don't know what California or other states are doing. It's hard for me to keep up on that, because every state's doing something different. I think in like Georgia or Virginia or Texas or somewhere, or even Florida, are allowing all the salons open. Hawaii, we're not allowing any salons or nightclubs or spas or bars open. So those things are not open until at least the end of June. They are considering reopening Hawaii to travel, and they're doing it by 2 ways. Internationally, they're talking about having a pact, kind of like Australia has a pact with New Zealand. They only let each other in. Hawaii will offer a way out of quarantine potentially for special countries that have a very low rate. Australia, New Zealand, South Korea, I think Taiwan, those are the ones they've mentioned so far. And they've also thought about, well, for Americans that are coming in, what are they gonna offer them? And the overwhelming majority of Hawaiians and Lieutenant Governor Josh Green and Congressman Ed Case and the other major Hawaii politicians, what it looks like is gonna happen is they're gonna either make people test, number one, at the airport at their expense, which could be $100 or more. In Iceland, they're doing 2 weeks for free for the tourist crowd in the summer, and then everyone after that, they're going to have to pay $350 in Iceland for a test to come in, or they'll have to quarantine. And I think Vienna, Austria is making it €190 test to come in. I think Iceland, Austria, and Dubai are the major countries I've heard of that are doing some sort of testing on arrival and making the travelers pay for it. And I think maybe South Korea and Hong Kong might do that or something like that. Again, their rates are very low, especially Hong Kong. John mentioned movie theaters on July 1st might be open. Yeah, maybe, John, but I think if the movie theaters open up, their sales are not going to be very good. I think AMC stock, AMC movie theater stock is still through the bottom and through the basement right now and not doing very well. And I think most of those movie theaters will not be able to sell a fully packed movie theater. They're only going to be allowed to sell like every third seat or something. So they're only going to be able to sell like 33% of their seats. I'm pretty sure that will happen in every single state and every single city around the country that way. So, that's sort of one of those things. So the other thing that Hawaii has opened up, we've opened up all beaches. We've opened up for everything, not just you have to be in motion or running. Today, or in Memorial Day weekend, it's a little cloudy today, but all Memorial Day weekend, I went to a few beaches. I surfed 3 out of 3 days. It was a pretty rough day. I'm pretty sore. But I saw, and I did spend some time myself socially distanced on a beach to tan, and they're allowing people to just tan and be in groups of 10. Technically, they are supposed to be in the same household or same family, groups of 10. No one is doing that. I can tell you, people were like, I saw younger people sort of drinking. No one was wearing masks. So again, we'll see. For the country, again, if you look at the states' rates of how states are doing, certain states are doing really well. And I got to tell you, certain states are not doing very well. Hawaii has basically not just flattened their curve, we've killed the curve completely. And to answer Hal's question, California has flattened the curve, but the case rate is still actually going up a little bit. Georgia, same thing. The argument was Georgia was the first state to open up, and their case rate has just flattened. But there's some question about whether Georgia and Florida are comparing the same numbers. I think there's something like Georgia and Florida threw in antibody numbers to reflect case numbers, and they're sort of fudging their numbers a little bit in a way. And then certain other states are not doing well. They're just flattening the curve. But I think every state has opened up. As I understand it, every state has opened up of the 50 states. Louisiana, that was really bad, hit and then went down, was starting to go down, but now they flattened. All I want to say is look at some of the links on my page that talk about the states. It's the one that starts 91-divoc.com. Go to that one. It's basically COVID-19 spelled in reverse.com. And then look at all the states curves. Look at Hawaii, and the other state that's done really well is Montana. Hawaii, Montana, and Alaska. Right now, Hawaii used to have the best or the lowest per capita cases, but it's actually Montana now. Montana is the best. Hawaii is the second best. We still have the lowest deaths per capita, I think, if you look at all the states. Hawaii has the best, lowest per capita deaths, I think, of anywhere in the country, and then Alaska, then Montana. If you look at total cases per capita, it's Montana's the best, then Hawaii, then Alaska. And then the rest are all like really sparse rural states: Oregon, West Virginia, Wyoming, Utah. Arkansas is actually doing really well though too. So, we'll see. But anyway, and I see a couple other questions coming in. Stacy says, how do you think COVID-19 compares to Hong Kong flu in terms of numbers, etc.? Again, Stacy, it's too early to say, I think, because right now we've seen let's not focus the world. Let's just focus on the country of America. We have 1.7 million cases and we have 100,000 deaths. Now, as I mentioned, and 477,000 of those 1.7 million have recovered. But that's still, more than 1 million people still have the disease and have not, quote unquote, recovered completely yet. more than 1.2 million in the US have not recovered. So that death rate is definitely going to go higher. It's 100,000 in the US. Now look, forget about, if you're just looking absolute numbers, again, the deaths have already way surpassed the normal flu in the US. And as I mentioned with John's link and the new CDC numbers of 0.04%, even with that, if you said 0.04% of the deaths, would be, it's going to be 1.7 million deaths of people that would be infected if you infected everyone in America. My point is, we don't know how many people in America will be infected. I think a lot more are going to get infected because of what's going on. We're opening up already. If we're opening up, and you've seen it, a lot of you I know have gone out in public just to Costco, and the lines at Ross, oh my God, there's lines, and no one's social distancing at Ross. I think everyone wants to buy cheap clothing. They're going to there in the Dollar General store because no one has money anymore. The problem is the rates are going to go up. The death rates are going to go, or the number is going to go up for sure. That maybe the case fatality rate may still be 0.04% like John's numbers, but that's still going to be high. So somewhere between 100,000 deaths and 1.42 million, as like John calculated out, it'll be somewhere in between. We're going to be somewhere between, by definition, 100,000 deaths already happened, and somewhere in the higher level of 1.4. But we're going to have, I don't know, throw an arrow in between, 500,000 deaths from COVID-19 before this is all over. The other thing I don't like, John, you mentioned a statistic. I read one of your posts that only 100 people in New York that are asymptomatic or that have no comorbidities died, okay? So for example, that sounds really great, right? Or is it 300,000? Okay, so 300,000 with deaths, okay. But the point is still, that is way worse than the flu, no matter how you cut it. And the year's not over, and we don't have a vaccine. And as I said, when this disease becomes endemic and infants are getting it and other people, there's still a risk that that could be endemic and that there'll be other deaths from that part. So I'm not trying to, here's a problem I have against the comorbidity argument. So John, as you mentioned, if there are only 100 people in New York City that die without comorbidities, that sounds really good. That sounds like very few people are dying, that you have a higher chance of lightning or whatever, and this and that, you know, getting killed by lightning or some of these other things. So that sounds great if you have no comorbidities. You know what the top 3 comorbidities? John, though, do you know what the top 3 comorbidities are? Hypertension, obesity, diabetes. Okay, now not all of us have diabetes or know people have diabetes. We know a few. But how many people do you know that have high blood pressure? How many people do you know that are overweight? I can literally count hundreds that I know personally that have hypertension or overweight. I could probably count thousands. I have like what, 3,000 Facebook friends, and easy probably a couple hundred of those, near 1,000, are probably overweight or have hypertension. So that is a false argument for me about only 100 people in New York died of that. How many people in New York died? In New York, there's something like total deaths in New York is about 29,000 people died in New York. Almost 30,000 people have died in New York. And John's point is only 100 of them died that had no comorbidities. Only 100 of those deaths were ones that had 0 comorbidities. It is very, very rare. My point is, when I look at a patient's chart, every patient has hypertension. Every single patient has hypertension. A majority of those patients in the hospital are morbidly obese or obese. They're overweight. They already have comorbidities. If you take your top 3, yeah, maybe not everyone has diabetes, but almost everyone has hypertension, and everyone that I know has struggling with their weight. So don't think that you're going to be one of those people that are completely no comorbidities. I say that most of us that are over age 40, I count myself, have comorbidities. I have comorbidities. I'm not going to tell you what they are, but I have comorbidities. I know like I look healthy, but I have comorbidities, you know? So that's the problem, right? So that is really the problem, okay? With that. Miles asked, are there any statistics that share the death rate of the specifically elderly with versus without pre-existing conditions? Miles, I don't know about any data. I'd love for you to dig that up. but I don't have any data on that. Okay, guys, you know what? This is really sad. I'm reaching about 50 minutes, and I have 5% left battery on my laptop. I'm sorry I didn't charge it up before. Instagram will also end in about 10 minutes, so this may need to end pretty soon. So I'll wrap this up. I will be back again. I think I'm changing my podcast from Monday and Thursday to Tuesday and Saturday. My friend brought up a point that maybe not that many people are available in the weekdays, and maybe more people be available on Friday or Saturday. Also, I'm going back to work tomorrow, and I'm day shift, so I'll have to have on Saturday a nighttime podcast around 7 p.m. Hawaii Standard, okay? So, yeah, again, John, even that 100, it's still, but again, this is a false argument, because if you look at comorbidities, and most people have comorbidities, so, again, your typical patient has comorbidities that enters the hospital, number one, and number two, that's over the age of 40. I don't know, to answer your question, Miles, I don't know many elderly that don't have comorbidities. Almost every single elderly patient I know has hypertension or kidney disease. That's another comorbidity, even a little bit of kidney disease, anything else like that, okay? So Daniel asks, isn't it just like HIV or cause of deaths on array? Yeah, so we're not, the problem with these statistics, looking at Japan, it may be how Sweden is, we're not very forward looking. Let's see how the data plays out. Things change week to week, and I'm back to doing these twice a week, so we'll see coming up. I am optimistic. Like I said, I have no problem with Hawaii opening up completely. I would even open up the bars, believe it or not, in Hawaii, because I have some friends that are struggling to make the rent and get paychecks and everything. And the problem with that is that right now, what I'm worried about is that it's not the Hawaiians. I'm worried about people coming into Hawaii. Here's an interesting statistic. I will end it on this. Did you know how many Hawaiians there were before World War II? And this is why Hawaiians are very protective. How many Hawaiians existed in the country, in the world of the total planet of Earth before World War II at its lowest? I'll give you a hint. There were more sea turtles in the world. Okay, there were only 29,000 Hawaiians left. They were extinct almost. And the reason why they were almost extinct is because that they were exposed to the white man. They had a ravaging of their society with measles, with tuberculosis, with leprosy. There's still a leper colony out on Molokai, okay? In other words, they didn't have any vaccines, they didn't have penicillin, they were ravaged by disease, and they were almost extinct. Right now, there are 500,000 or so Hawaiians, so there's a lot more, okay? So my point is, and here's where I want to ask you a statistic. Remember the beginning of this where I asked you how much percentage of Hawaii do you think is antibodies? Remember, New York, 20%, in the Bronx, 32%. Sweden, that tried to get herd immunity, was 7.5%. They just studied a random sampling of healthcare workers in Hawaii. And healthcare workers probably have the most exposure to COVID-19, right? And they represent a broad section of ethnicities and ages and whatever. Hawaii, 1.9%. In other words, only, yes, 2%. So John, you have a society like Hawaii that has 2% exposure, right? Compared to New York that has up to 32% exposure. So what I'm saying is Hawaii is sitting on a ticking time bomb if we just let everyone in. You're going to have Hawaii extinction, or at least sickness, grave sickness all over again, if you suddenly try to make it endemic and let every person in with COVID-19. We're gonna go from a 2% antibody rate and being exposed up to suddenly 20 to 30% like New York. Hawaii will be destroyed. It will be destroyed. We do not have enough ventilators. I work in a tiny hospital that has 20 beds, okay, 20 beds. We have like 5 ICU ventilators. We can maybe get another 5 more. We can get a total of 10 ventilators. We don't have the ability to take care of all this stuff. Our largest hospital doesn't. So, that's how it is. So that's why, and again, I will agree with John and other people that we cannot treat every city the same. We shouldn't treat every city like New York City, and we shouldn't treat every place like Hawaii. You're going to have to make your own decisions. And this is where the states and the governors need to have good leadership. whether you like Cuomo or you like Ige or you hate them or you like Fauci or hate them, you cannot, yes, we need federal guidelines. We need some guidelines, but the ultimate decision has to come down to state. And we need better leadership. We need better testing. We need better contact tracing. That's all never change. And I'm actually more in favor of even New York. New York's curve, let me take a quick look at it again. New York's curve has really changed and is really flattened down and is slightly going down. It's slightly going down. It is starting to trend downwards. But again, if we reopen New York, if we reopen up the bars or open up, which I don't think we should open up the bars or whatever, but say we open up all the different things and retail and restaurants for dine-in, socially separated, we have to be willing to accept that we might need to phase back up. Okay, so I'm okay with that. And again, I'm actually, believe it or not, if people don't want to get the vaccine and people don't want to wear masks, you know, we can't force them to do it on some level unless you really, depending on what you believe about government's ability to restrict people's rights for a public health good. I mean, for example, we have a lot of states and a lot of cities ban people from smoking. Why should we prevent people from smoking? It's their right. It's because it impacts people. The smoke itself is annoying. So why shouldn't states be able to regulate whether you wear masks or not? You know, that's my point. We also we regulate that people have to wear seatbelts when they come in a car. If you ask someone in an Uber car that you got into or an airport shuttle that's driving you and your family home, you're not wearing a seatbelt. Can you put a seatbelt on? If they got pissed at you, right? That doesn't make sense. It's still illegal. They can still get ticketed. And it's uncomfortable. I would rather drive without a seatbelt, but it's for the greater good. States and countries and cities ask people to do something for the greater good all the time that's not uncomfortable, and no one blinks an eye about it. Smoking, seatbelts, wearing, having life vests, right, in airplanes and boats. We're never going to use it. You're probably not going to be in a sinking ship or a crashing airplane, but they're there for a reason. And that's that sort of thing. Yeah, John, I agree. That's why I'm happy to be in Hawaii. John brings up a point. We have 5 branches of the military in Hawaii, 30 minutes away from everybody, and the National Guard. So even the National Guard got overrun. I would rather spend the pandemic here, but I don't want us to be in that setting where we become a New York-style epidemic or New York City-style epidemic and get destroyed in Honolulu. It would be absolutely devastating. Yeah, so Brian brings up the point, ventilators won't be a problem, it'll be household beds and medical care. Yeah, okay, so that's it, guys. Again, my battery's about to die. I'm trying to keep it under an hour. To everyone out there, thanks again. Stay safe. And again, whether we disagree or agree on how we're supposed to take care of it, I do not want any of you guys to get sick. I'm happy to discuss a little bit more about the complications of COVID-19, and I'm going to talk to a couple of my New York doctor friends and get more information. And you've all read about how scary a multi-organ, that's a key word, multi-organ disease is for kids with the multi-organ inflammatory syndrome, the Kawasaki-Tau stuff, the strokes, the blue COVID toes, it's everything, and the permanent lasting lung damage and kidney damage too. It can be a problem. Like, no one wants to be a young person to have kidney damage and might need dialysis or anything else. So thank you guys, stay safe. And again, I will save this on my Instagram stories. I will upload it to YouTube. I will save it on Facebook. Feel free to forward it to your friends and family. Again, this is Dr. Albert Lin, the traveling doctor. Again, I represent myself, not anyone else, saying aloha. And add me on Facebook at The Traveling Doctor, or on YouTube at The Traveling Doctor, or you can also add me on Twitter, which I don't use that much, but at The Traveling DR. Same thing on Facebook, you can find me there, and Instagram at The Traveling_MD. Forward it to your friends and family, and we'll meet up and talk again on Saturday, again, at 7 p.m. Hawaii Standard Time. So I know a lot of you will be asleep on the East Coast, but it'll be 10 p.m. in California, okay? Adios, guys. Aloha. Bye.